Let's bring on our next guest. Spent a few minutes chatting with him. He was very vocal, and we love the vocality. We love it. A palliative care physician, Dr. Naheed Dosani, joining us. It's great to have you on, as always. I hear you on with Kelly Contreras yesterday. I'm trying to book you. I'm thinking I haven't heard your voice in a while, and I want to, and I got to listen, and now we get to talk.
So great to be on. Thanks so much. I missed you, man.
Are you literally? But you had to move to an earlier time. Are you like Are you in your scrubs, pajamas? Have you had breakfast yet?
Yeah, you're absolutely right. I'm just about to start down breakfast. I'm in my scrubs, about to head out. I don't know how you do that, but yeah, absolutely.
When you're doing the heavy lifting and helping people, I'm in dreamland in the middle of the afternoon. That's how I do it. That's volume when it comes to naps. I was saying earlier at the top of the hour that I was relieved in a way that I think yesterday's protest, well, it's not great there's any protest outside a hospital, and you were very vocal about that. It just felt like a real wet blanket, and even the media coverage of it, if anything, has aligned more people to say, yeah, that's the wrong thing to do. So I'm glad it gets covered. I know Dr. David Fistman, who we both know, and I'm like said, well, we shouldn't cover them at all. But no. Let's show you the fringe of society here, these anti-vaxxers that have been around for 20 months, and let's keep letting you know that we've got to be aware of them. We've got to be conscious they exist.
Yeah, I too am glad that the media did cover the issue. There's a way to cover this issue without kind of galvanizing it and kind of creating a sense that these are, forces out there that are equal, in the sense that, this is a small minority that's really loud. We can't present it that way. And I think basically the way the media covered it, and also because so many healthcare advocates spoke out just over the weekend on social media, in the media, in the public eye, I think it did actually dissipate the number of people that came out and the impact that they had. And that shows you the power of communications. It's really important for us to learn from these lessons.
Do you make the distinction between those who have been, they're the people long before vaccines, Dr. Dosani, long before vaccines, they were like, this isn't real, and it's the flu, and this and that, and government control, and those that are generally hesitant, generally concerned, saying, I've done what I've done for 25 years. I've always done what's asked. I always come to work. There are healthcare workers that are saying, I just don't know yet about the vaccine. Or do you not have empathy for them after all this time, all this research that's been done, and all the messaging that's out there? How do you feel about it?
I love this question because it really speaks to where do we go from here. I mean, it's kind of, in a way, easy to kind of be angry and upset and, post tweets about how people shouldn't protest outside of hospitals. But what do we do today? Because I do believe that there is a group of people, a small minority out there, who we will probably never convince around a COVID-19 vaccine. And they've always been in that fringe kind of movement, and that's not going to change. But there are people out there who just need a trusted conversation, need compassion, more information. Some people still lack structural access due to employment issues,
but not much of that now, right? Like I still maintain these are choices. It's less about access. We can agree on that than it was in April or May. It has to be.
I can agree it's less about access, but I still think people are out there who need trusted information. For example, I have a friend who has a best friend who just won't get the vaccine, but I booked a call with me today, and we're going to do a three-way call. We're going to work through her issues. And the sense is that she just doesn't have the right influences in her life. And maybe with a phone call with someone like me, I might be able to walk them to a place where they can have a better understanding of why the vaccination is important. This is a different group than the spring, for sure, or in the summer, but it's still an important group. We have to work on this group. We can't give up. And I think calling this group names and insulting them will only push them further away from our.
I agree with that. And that's why I think those people were best staying away yesterday. Those are the people that I don't think they were there yesterday. I don't think that's something they would do. They're more in their homes. They're in their bubbles. I mentioned a stat from the United States where 68% of Asian people have been vaccinated by race. These are stats: 68% Asian, 52% white, 48 Hispanic, 43 black. So we've got a much less of a African Canadian population. It's something like 4% here. It's 13%. So that's a huge volume of people in the United States. But you're not wrong. These are the people that are going to be hurt by a vaccine mandate. I get that. But they're also the most hesitant. So we've got to figure this out in a hurry because it's going to have a disproportionate impact. And what I found demeaning about some of the messaging, Dr. Dasani, is just, well, they don't have English as a first language. And I thought, come on. I mean, my kid's soccer team's a regular United Nations. There's plenty of parents that don't speak English as a first language. They know to go get vaccinated. They know to go to their jobs. They know how to get to the airport. Some of the messaging's a little insulting. Everything you said's valid, but some of the messaging I fudge on.
Yeah, we have to be very careful and nuanced about how we speak about this. We cannot get to a place where we're doing an us and them kind of game. We can't be othering. We must understand that not all unvaccinated people are quote unquote anti-vaxxers. This is a nuanced conversation that needs sophistication, empathy, and compassion. That's really hard to ask of people at this stage in the pandemic, especially health workers who've given their all and are, facing moral injury and compassion fatigue after events like yesterday. But if we don't show empathy and compassion, we won't get 90% of people vaccinated, which is a really big goal and an important goal to move forward.
Tight for time, but I want to ask you about messaging. What's the one aspect? One of the things that's driving me crazy is some of the messaging about booster shots in the United States and seeing it in other countries. Because once you start they're not for everybody right now, but once you put that out there, that was out there about a month ago. Well, Pfizer's considering a third shot. That's almost making people think that the vaccines aren't doing what they're supposed to do when they exactly are. Is there any aspect like that that's frustrating for you?
Yeah, that one is kind of frustrating on one level around people then saying, well, the vaccine doesn't work, but also because, less than 2% of people in low-income countries have even gotten their first shot. So there's a global inequity issue there that I'm super kind of concerned about, but also just around the history of the vaccine. And one that I get all the time is that this vaccine doesn't prevent people from getting COVID. We really need to get the message out there that you can still get COVID, but it prevents the likelihood of hospitalization, ICU admission, and death big time. And I think that's one that we need to work on. So you're right. These are, major points in the discussion and education piece that need work, and we need to continue to amplify those messages.
Well, and just alone, I'd double down on what you said, brilliantly, and say schools. There was always going to be COVID in schools, but how is it manifesting itself? Is it in, especially in high school, are kids vaccinated? That's going to be a harder sell, as you know, is even once it's authorized for 5 to 11, I'm not sure what the uptake is going to be for parents who decide to vaccinate a 5 or 6 year old. I think I would. You might say you would, but we know if you're hesitant for yourself and you're in your 30s or 40s, you're going to be hesitant about vaccinating a little kid.
That's so true. It's such a unique and different population. And once we get approval, that doesn't mean it's going to just necessarily work. That's why it's so disappointing, particularly here in Ontario, the lack of action that we've seen on schools. And unfortunately, I think we're starting to see the cases go up, and we're going to see the ramifications of that quite soon. Yeah. So, it comes back to policy and our political leaders, and what they're doing and what they're not doing. And, we need to pay attention to that, especially the next time we go to the polls here provincially too. Hugely important. Dr. Dasani, thanks so much. Great to hear your voice. We'll have another conversation sooner than this gap in our last one. And let me know how your conversation goes today. I'd love to know and share it with the audience since you shared that with us. That's what the show's about. Let me know how that goes today, and good luck. Absolutely. Will do. Thank you so much.